talk a little bit now about dosing and how to actually get this into your system. So do you guys have any ideas on methods of ingestion, the different ways that you can get cannabis into your body? Okay, topically. So I'll start a list here. So we have topical. And topical is great because it doesn't get you high. Or in very rare cases it could. But for the most part, topical is just for the area that it's applied to. It won't give you the high. And so a lot of people find benefit from the topical. It's great to use like in massage creams and that kind of thing. Can really help with the inflammation without the high feeling. And then smoking. So smoking or vaping. Vaping is thought to be a little bit healthier than smoking. And the main benefit from that is that it gets into your system quicker, so more immediate relief. Any other ways?
Ingestion.
Yes, so edibles. So edibles can have, they can work great, but it's really important that you know your dose because they can also go really wrong if you don't. So the advantage to the edibles is they stay in your system longer. The disadvantage is they usually take longer to reach the effect. And then similar to edibles, we have sublingual preparations. So these are absorbed in your mouth, under your tongue. They start to go into your bloodstream quicker. So that would be lozenges and topical or sublingual sprays and things like that. Certain edibles like Jolly Ranchers, they kind of have a little bit of both. They start the absorption, it's absorbed under the tongue, starts to get in the bloodstream, but then you're also swallowing it, so you'll have a little bit of that edible effect where it's a little bit prolonged. So sublinguals are kind of a good mixture because they'll have a quicker onset, but they kind of last longer like the edibles.
So what about like oils or tinctures?
So that would fall under, that would kind of be both. It would be a form of edible. Tinctures, let's see. But it kind of starts to have the sublingual. So it just kind of depends how, if you just swallow it right away or if you hold it under your tongue. So if you hold it under your tongue, in your mouth, it starts to get absorbed through your cheeks, under your tongue, any of those areas, you'll start to have the quicker effect. But if you just swallow it, then it'll take longer, but it'll last longer.
Can you kind of elaborate on like quicker effect? I know it's probably different for everybody, but is it like minutes to hours?
Yeah, so usually sublingual will be within 5 minutes, 5 to 10 minutes. Edibles, really, another reason they're dangerous is because that can range depending on somebody's metabolism and what they ate. So an edible can start to have an effect after half an hour, but if you're somebody that has a slower metabolism and you just ate a huge meal, it could take 4 to 6 hours. And so a lot of the products on the dosing, it'll say wait 2 hours before you redose. But if you're somebody that doesn't feel it, is not going to feel it for 5 hours and you redose twice, that could be a not so comfortable experience. But the thing about cannabis is that you can't overdose on it. So there's no endocannabinoid receptors on your brainstem, which is the part that we worry about to shut off breathing. And so like with opioids, that can happen where you stop breathing and you die. We have a lot of opioid overdoses, but that's not possible with cannabis. So another method of ingestion is suppositories. So this is good for people that want a more direct route if they are using it maybe for menstrual cramps. Sometimes people are using it for prostate cancer or bladder cancer or things like that. It's also a good option for people that need high doses of THC. Some disease states have better data for THC versus CBD or which ratios. And if you need a really high dose of THC, you may not be able to tolerate the psychoactive effect. And so in the suppository form, you won't get high from it. let's see, am I forgetting anything? Let me
What
look
is
at my-
this suppository? What does that mean?
So you would either rectal or vaginal. Let's see if I'm missing any. The last one is transdermal. So that one's not really as common. I don't see that many people doing the transdermal, but that would be similar to the topical, except it would be designed to go all the way through to the bloodstream. So that one would last for quite a while in your system. So that one would be more for people who have used other ones and really need a higher dose at that point. They've really built up their tolerance, or they really need high doses for their condition. And then the transdermal patches can stay in your system for like 12 hours. So that's a pretty long duration.